Hi, I'm Michelle Rupp, host of AFMC TV. Thank you for joining us. AFMC TV is a place to consider as a healthcare hub. AFMC is a healthcare nonprofit. We specialize in making our lives, businesses, and communities healthy. This space was created to share information with the community. You'll hear from healthcare experts on a broad range of topics. Medical topics like immunizations and telehealth, to lifestyle topics like strengthening a routine or keeping your family hydrated. Our promise to you is to keep you informed in a digital way, providing useful information to you and your family. Again, thank you for joining us and welcome to AFMC TV. About the vaccine. In the next hour, we will
very hard to play. This video will provide ideas and also make sure
Thank you for joining me for this week's edition of AFMC TV. We are actually talking about healthcare technology on today's episode. And joining me now is Nathan Ray. Nathan, you work here with me at AFMC. You are all things healthcare technology.
Well, thank you, Michelle. It's great to be here. And yes, I wear many hats among technology and business operations. I'm glad to be a part.
So let's start by talking about just the evolution of healthcare technology that you've noticed.
Several years ago, I was part of a federal grant with the Office of National Coordinator for Health IT that AFMC managed here in Arkansas. And what we did was we worked with providers all across the state to help them adopt, implement, and upgrade their electronic health records. That program also went hand in hand with the Health Information Exchange, which I know we'll talk about soon as well.
We started at paper.
We did.
We might have even started on stone tablets for some. Progressed to paper. Now everything's electronic. Where could it go from here? I mean, and particularly now in a post-pandemic world, healthcare technology has accelerated.
It has, and so it's really interesting over the time since that program was rolled out here in the state of Arkansas to where we are today. A pandemic's occurred, and we had a process where a lot of things were still on paper. Even 2 years ago, there was some paper in a lot of processes, both internal to organizations and external. It's now gone almost 100% electronic, so you're not seeing as much paper. You're seeing consent processes electronic, and you're seeing the transition to mobile devices. But with that also comes security risks. So those two have changed over the past several years.
And that was my very next question is, this all sounds great and wonderful and so futuristic, but there's a huge risk because when it comes to security, because you've got a human's entire profile.
You do, and it's a lot more accessible, and a lot of systems now are modular. So you'll see systems where you'll have part of an electronic health record in one system that's interfaced with another system. So you have not only interfaces built between multiple systems, but you'll also have more information accessible external to the organization, and sometimes multiple organizations to really make sure that all of that is available to the healthcare provider, but also the patient. So you have the complexity of interfaces, you have security considerations, and you'll see as a patient now more and more push for multi-factor authentication. So this is oftentimes what you'll see when you're doing mobile banking.
And I do think it's important to note that all of this is and has to be HIPAA compliant. And for those who may be watching that aren't in the healthcare industry, but they are just regular people like you and I who are concerned about our privacy and security to some degree. What are some of the stopgap measures that are put in place to protect their identity and protect their records?
Well, there's a lot of things, and I'm sure we can talk more about this too with Share, the HIE, in terms of what they are doing for authentication. But from a patient perspective, you want to make sure you have a complex password, and there's a lot of ways you can do that. Complex passwords, use different passwords. Password managers are a great solution as a tool to really protect yourself. Of course, multi-factor authentication, we talked about that, to really layer on top of the password and different passwords is a good thing to do, and you'll see more and more of that in the healthcare setting. So those are things that you can do as a patient. As a healthcare provider, I'm sure many of those that watch this show and are involved do annual security risk assessments. And so that's another tool that as a healthcare provider, you should absolutely do at least on an annual basis, if not more often, to make sure that you're mitigating and addressing risks as they occur, because they evolve daily oftentimes. So those are some things from a provider perspective that you should take into consideration, in addition to the basics like keeping your systems updated, having backups that are fully encrypted and available, and redundancies in those systems.
Wonderful. Okay, if you've got a moment, we want to go ahead and bring in another guest from Share and just kind of continue this conversation. Welcome back. Thanks for joining us. We have added Ann Santafer into the mix with us today. And Ann, you're with the organization Share. And why don't we first start by talking about what does Share stand for and what's the organization?
Sure. Share is Arkansas's only statewide health information exchange. Okay. And what that means is, earlier Nathan talked about providers purchasing health information, electronic medical records, right, to do their day-to-day business in a computer rather than paper format. Well, just much like Apples and Androids, EMRs to EMRs, electronic medical records, don't generally talk to one another. So Health Information Exchange came about around the same time that, the ONC grant was founded to support electronic medical record systems in a way to kind of be the translator between the different organizations.
So a person, just a regular person on the street, myself, who doesn't know about the technology world, is it correct in thinking, and I think that it is, I visit my primary care, and she has her documents and my medical records, but then she recommends a specialist. And so in my mind, I'm thinking, okay, great, my records should already be at the specialist's office. Is that correct thinking, or is it flawed thinking, or is it's probably not that simple though?
It can be. Okay. It depends if both of your doctors are participating in Share. So Share is a voluntary program.
Okay.
Where doctors can choose to sign up. They send their data to us. We are the keepers of it, so we hold it all in one safe and secure location. So it can be that simple, as long as both providers are participating in the Health Information Exchange.
Okay. And as you said, they have the option to opt in, but not everyone participates.
Correct. Not every doctor participates. Today, Share has 79 hospital systems they're participating, as well as over 1,500 provider practice sites that are contributing data. We have another 2,500 or so that just retrieve it. So maybe, they don't have a sophisticated electronic medical record, or maybe they are not quite ready to jump into that pool of sharing data, but they still need to access some information. They still want to know what happens when you go to the hospital. So we have a lot of information. We have data today on 3.4 million Arkansans.
That's just amazing, because we were talking about the system and the program where we were helping folks adopt and upgrade systems, right, for electronic health records across the state. And there were 0 records in Share. And here we are with millions of records that are available to healthcare providers to make our care better in the state. So I think that's a really good thing, and a testament to what Share has done, and then also our Arkansas providers. It's amazing.
So a lot of times, and you may not know this, when you fill out the paperwork at the provider's office, at the doctor's office, somewhere in there, there's some language that says, it's okay for you to share my data with Share. So there's tiny language in just about every doctor's office's paperwork to educate you. And we do, webinars, and we have flyers, and anything we can do to educate the doctors, but also the patients on the benefits of this.
Well, that is just Just fascinating. And really keeping with this theme of healthcare and healthcare technology. When we come back, we're going to actually put this to use, and we're going to visit with a provider in DeQueen via a little technology and see how electronic medical records have transformed their practice when we come back. We are joined now by Angie Walker. She is the wife of Dr. Randy Walker in DeQueen, where he has a family practice. And Angie, thanks so much for joining us on AFMC TV. This is exciting. You are actually our first interview virtually, so we're excited. And isn't it fitting that we're talking about healthcare technology and we're using it?
Yes.
I'm curious, share with us some of the struggles, first of all, with healthcare technology that you guys have experienced, because it hasn't always been rainbows and gumdrops.
No, living in a rural area, our access to the internet is extremely limited. There are days that we have great internet. There's days that 3 o'clock comes, the kids get home from school and it doesn't move. There's days that it rains and it doesn't work. And so that one is a big one for us as far as technology goes, because we're electronic medical records. We've never had a paper chart. And so that's one of our biggest issues.
You guys have used technology before, though, pre-pandemic. Technology has been a big focus of the practice there.
We're big. I mean, if our IT people say we need it, we're doing it because we know that this is where healthcare is moving. This is, especially in a rural area, we don't have access to the specialties, to the testing, to the different things. And we know for us to be able to have access to that and give access to our patients, we're going to have to pull technology in. I mean, that has to be a weighted factor. There's no other way to do it.
How long have you guys been on kind of the forefront here of technology?
I would love to say forever. I mean, it's kind of been our, when Dr. Walker opened practice in 2003, it was never a question about a paper chart. It was no, we're electronic medical records. We were one of the first practices to do the meaningful use, moving through all stages of it. We do a lot of demo stuff for eClinical Works when they're looking at different modules and what have you. We're always going to be the first one to raise our hand and say, yes, we want to do it, because we know that we're helping to shape what's going to happen. If you can't really complain about it if you didn't jump up and participate in molding it into what it needs to be.
Yeah. Talk a little about how your patients have embraced the healthcare technology, or not.
Well, and I'll tell you, so, pre-COVID, you had that demographic that liked that, that 30 to 40-year-old, they're working, they're busy, they just want to do a telehealth visit and move forward. Now we're on the backside of that. We're actually trying to do policy and, what is our clinic, what's it going to look like for our clinic, and managing those patients going forward? What things are we going to be able to deal with via telehealth? And what are those things that we're like, no, that's really an office visit?
And my last question, I'm also curious, what type of notifications does your office send out as it relates to maybe it's time for a checkup, or maybe it's time for those immunizations? We're August now, school's starting in a matter of days, and for some in a matter of hours, it probably feels like. And so some of those last minute checkups, are you guys able to send those reminders via text message?
Absolutely. So within our system, we have what's called campaigns, and we set those up. A lot of times we set them up annually, but there are times when we're looking and creating depending on what's going on. And so we set those up on the back end, and it'll identify those patients that fall within that demographic, whether it's time for a physical, it's time for a wellness visit, or you missed a vaccine, and automatically sends those out for us.
It's amazing how technology is now playing such a big role in our lives. Angie, thank you so much.
Sure.
I appreciate your time.
No problem.
And when we come back, we will talk about immunizations and what you need to know for your child. Welcome back. Joining me now is Heather Mercer of Immunize Arkansas. Heather, thanks for coming in.
Thank you for having me.
My first question will be an obvious one. Tell us about Immunize Arkansas for people who don't know who the organization is or what they do.
Well, Immunize Arkansas is a nonprofit organization. Our mission is to educate and advocate for immunizations for all Arkansans. And a couple of things that we do is we have some focus groups or work groups that are focused on priority areas, like childhood immunizations and COVID. And then we also have 2 summits every year for healthcare providers and public health professionals. We just had the HPV summit in May.
Okay.
And in the fall, we'll have a big immunization summit.
Okay. So all things immunizations, I guess, if you will. August is National Immunization Month. Did I get that right?
Yes. August is always recognized as National Immunization Month.
Okay.
And it's an annual observation that highlights the importance of immunizations.
Yeah.
And this year, it's even more important than ever, especially with kids going back to school.
That's right.
And so a lot of kids may be behind on their school immunizations. Immunizations are one of the most important things that parents can do for their kids. And from babies going into daycare to a freshman going into college and everything in between, there may be vaccinations that are required for kids to go to school. So parents need to check with their providers to see what may be required for their kids to go to school, and they don't need to wait until school to find that out.
Is there concern, particularly this year, that vaccines or immunizations aren't going to be taken this year because we're just tired about it? Oh, we don't want to hear about it anymore.
Well, vaccinations have definitely been in the spotlight more than ever because of COVID, in positive and negative ways. And there's been a lot of misinformation out there because of that. But I don't think that it's going to have a trickle-down effect for people not to get their vaccines. And one thing that we definitely want to make sure of is that people get their flu vaccine this year, because we had such a mild flu season.
Yeah.
And part of that was because of all the measures we took to mitigate COVID.
Yeah.
We were wearing masks and social distancing, and people were working from home. So we had a very mild flu season. So I think people are going to think they don't need to get their flu shot. Well, that is not the case. We definitely need to get our flu vaccine because things have opened back up.
Okay. So bottom line, get those immunizations, get current, don't skip them.
Right. Yeah, and we still need to get our COVID vaccine. The Delta variant is a real thing, and the people that are getting COVID and dying from it are unvaccinated people.
Okay.
Or under-vaccinated.
All right. Heather, thank you so much.
Thank you
for coming in. It's been great talking with you, and hopefully we've provided parents with some good takeaway information.
Yeah, I hope so.
All right. Thanks so much. Thank you so much for joining us. We'll be back here next Wednesday, and we hope you'll join us then.